If you hadn't already, by 7 months old, your baby's first tooth is starting to make an appearance and they may get a little fussy because of that. I am Dr. Nkirika. I'm a pediatrician, a pediatric ear doctor, and a mom of 3. Today we are chatting about our babies at 7 months old. Around 7 months old, most babies are starting to develop one or multiple teeth, and this can be stressful for both the baby and the parent. Your baby might show signs of teething by drooling more, chewing on their fingers and toys more, generally drooling, or just being fussy because they're uncomfortable because of all the irritation from the tooth. Some helpful and safe options to help with the relief for their teething are things like using a cold rack soaked in water and put in the freezer. You can give it to them to chew and gnaw on their gums just to kind of give them some cold relief. You can also make breast milk popsicles. You can use a tray like this. You can pour breast milk inside, freeze it, and have your baby chew on this. These breast milk popsicles have dual benefit because not only is your child chewing on it and getting relief with their gums, they are also sucking and feeding on breast milk. There are also different types of safe teethers and teething toys in the market. I want you to pay attention because some of them are supposed to go in the fridge and some others are supposed to go in the freezer. This particular teether, for example, is meant to be placed in the fridge and not in the freezer. If you place it in the freezer, it might get too cold and can actually cause a cold burn for your baby. If you are not sure what the difference is or which one to choose, ask your provider, read the instructions. A lot of them write in the box which one's supposed to go in the freezer or in the regular fridge. For teething relief, you can also use acetaminophen or ibuprofen if you think your child is super fussy and not getting comfortable alone with the teethers. Along the lines of fussiness with teething, some babies may have more runny stools, or you may notice some mucus in their poop. This is because they're drooling and making a lot more saliva, so you may notice a little bit of mucus in their poop. This usually goes away on its own and needs no intervention. Contrary to popular belief, teething does not cause fevers. A lot of babies around this time are starting to teeth, so they are also reaching out and putting their mouth on surfaces that contain viruses just to soothe themselves, and they may get the virus and then get sick and get the fevers. So teething does not necessarily cause the fever, but they're exposed more, which is why they have the fever. So around 6 to 7 months old, there is really a lot going on around teething and drooling and maybe a little bit of diarrhea as well. As regards development, your baby is a bouncer. Once you hold them and want to put them down, they tend to want to bounce more, and this is like exercise, fun for them, but also make it fun for you. Around this age, they are also making the transition from sitting without support, trying to go on all fours, and even attempting to crawl. When they start to crawl, a lot of them around this age actually start to crawl backwards first before they crawl forwards. Their attempt at crawling and crawling backwards is usually very cute to watch. Give them some time or give them a boost from behind, and when they try to crawl, try to support their buttock or their legs from behind, and they can start to move forward. But otherwise, by the time they're 8 months or 9 months, a lot of them figure out crawling and actually start crawling forwards and normally. Around this time, some families may start discussing weaning. So some babies may start to transition easily from breast milk and formula to semi-solid food. Some others may have a struggle and not necessarily be comfortable with all those textures being offered. So while you're discussing weaning from breast milk and formula, I want you to remember this has been their primary source of food for the first 6 months of their life. So I want you to go easy. Don't be in a rush. Continue to introduce different flavors and foods and let them take as tolerated. And when they want more, you can always supplement with breast milk and formula because they still need to continue getting their nutrition from both. If you already started introducing semi-solids, baby food, and cereals to your baby about 6 months old, leave a comment and let us know what you did differently. That is great. If you're a parent that's just about to start introducing baby foods and cereal to your baby, that is also great. One of the recommendations I always have is to make sure you have an antihistamine in the house, just in case they break out in a rash or allergies. Since this is the first time they're getting exposed to those feeds, it's not uncommon for some babies to have an allergic reaction with their first reaction to foods. A few tricks to introducing new foods and also getting them accustomed to feeds is to go slow with the textures and also be patient. A lot of these foods, they tend to take you multiple times before they get used to it and then actually start tolerating it. One trick that really worked for me was to introduce a new food with the one they tolerated before. So let's say my baby loved bananas. I can mix the bananas and the new peas or bananas and carrots. That way they can still get the flavor of the bananas they really liked with the new one of the carrots, and they tend to get used to them over time. And that actually made it easier for me to introduce new foods to my babies. So there is no one size fits all when it comes to feeding schedule, but now that you're introducing foods to your baby, you should still make milk their primary source of feeding. So for instance, you can still continue to give about 6 to 8 ounces of milk every 4 hours for their feeding per day. And then you can give them baby food, solids, like 3 to 4 times a day. So that way they're gradually getting used to it and still continuing on the milk or formula without losing weight. And now, if you have not already, this is a great time to baby-proof your home. Your babies are probably on the move, crawling, rolling, sitting, based on the range and what they're doing currently. So you want to baby-proof your home. One, drop your crib settings to the lowest because they're definitely attempting to climb out the crib, or maybe their legs are not long enough yet. They tend to fall out. This is also a time to check for small toys and objects like things like coins, button batteries, pins on the floor, because these babies are movers. They're not necessarily sitting in one place anymore. They are moving and reaching to places you never knew they could reach to. So these are things they're easily going to get injured with, or things they can choke on. So you want to pick them as much as you can and get them out of their surroundings. If your baby's crib or bassinet was in your own room before, this is probably a time you can consider transitioning them to their own room. Yes, American Academy of Pediatrics recommend having the baby crib or bassinet in your room for 6 months just for more supervision. But as they get to 6 months, this is when families tend to bond together, or couples and partners tend to bond together, and you can actually transition them to their own room. While we make this recommendation, we also understand the different levels of attachment of like families to their babies. But this is also when you want to reestablish connection with your partner. So it's okay to transition your baby to their own room while you continue to monitor them by checking on them, having a video or a camera where you can easily see them if you hear noises from their room. And that's it, from teething to crawling to feeding and transition to their own room. Some of the things that may happen with your baby around 7 months old. And I will see you in the next video for your baby at 8 months old.